Thanks, Lauren, for being a part of this interview today.
Oh, absolutely. Thank you for having me.
Oh, delighted that you can be with us. So tell us a little bit about functional medicine. And, it'd be helpful to have a basic description, but then also maybe it describes what is so attractive about this field.
Yeah, so functional medicine is a medical model and it looks at the root causes of disease in patients. So, not just focusing on symptoms, but rather focusing on the whole person. And it really involves that patient centered care, patient centered support. It's very personalized and it really examines a lot of different factors. So, it looks at genetics, it looks at lifestyle factors, biochemical factors to really help. Providers develop treatment plans for patients. And it really encourages that prevention side as well.
That's really cool. So, what attracted you to that field?
I think what was most attractive to the field of more functional medicine is really looking at the whole person and also that collaborative approach. So it really brings in a lot of different areas of expertise to help fully support patients and to help them understand their treatment plans and really make them a partner in their treatment plan and moving forward in their health.
That sounds great. What are the different roles in functional medicine?
So there are a lot of different roles, which is really great for students or for folks who are interested in these different career paths. So you have kind of your traditional training pathways that you can take, like physician, like an MD, DO, PA, nurse practitioner, dietitian, and there are also some more supportive roles, and there are some different avenues that folks can take that they can maybe incorporate some of that functional medicine training. So, for example, if you were in mental health, in any area there, social work, nutrition, massage therapy, the area of functional medicine may also look at alternatives for treatment, like I mentioned, massage, acupuncture, resilience training, stress management, and some of that health coaching as well.
That sounds really interesting. So, what skills and training would go into some of these roles that you would need for this field?
Yeah, all sorts of training. There's really all sorts of groups out there, um, conferences and things you can attend to get some sort of supplementary continuing education. And a lot of times, if you're in the role of a licensed individual healthcare provider, so maybe as a physician or a nurse or a dietitian, you're required to get some continuing education. So a lot of times you can look up continuing education on health coaching, lifestyle modification, even leadership. Really big emphasis too out there nowadays with nutrition and just kind of understanding how our bodies kind of respond with different foods and just the research kind of behind nutrition. Yeah.
So, what advice would you give to students who are considering this field?
I would say to just take a really deep look at your vision. And we talked about this a little bit earlier, this idea of a vision versus a goal, whereas a goal might have an endpoint and a vision is really expansive. And I think just first off, just starting to see where you want to be and how you want to help others. You know, if you're attracted to the field of functional medicine, or maybe you were down a path of, more traditional behavioral sciences or pre-med, and you're kind of looking for ways to supplement that, is just to consider who you want to help and what sort of population you might be interested in. There's a lot of different areas you can go into. So my advice is really to consider that vision. And I'm not saying to have like some big 5-year plan, but if you can have an idea of where you want to be, then you can kind of start to figure out some of that pathway. I would also say, don't be afraid to forge your own path. I know it seems daunting to break away from the norm or from the, path that might be laid out specifically for a certain area of health. But if you can explore as much as you can, I say do all kinds of informational interviews. And I think some of the best advice that someone gave to me is just that, when people love their jobs and love their careers, they want to talk about them and they want to tell you about them and kind of what their pathway looks like. very few folks have a very, linear pathway to their careers. And I think that's also something that's attractive to folks who are interested in health and behavior and medicine, is that they really want to help people, and they're going to look for a career instead of a job, a 9 to 5. They want to give their energy to other people. And I think that's really, really impressive. So to stay flexible, as well. And if something doesn't work out the exact way that you planned, when it comes to getting into a certain program or going to a certain location, landing a certain job or internship, that there are so many opportunities out there. There's so many internships to consider. And oftentimes, if there's not something there, it never hurts to ask. There's a lot of places that need help, and they need eager and willing and really dedicated students who are interested in helping. I think that's a big thing that we notice when students approach the idea of an internship, where they say, I'm really, really passionate. I just want to know more about this. And for some, they figure out they can cross it off their list and it's not something they're interested in. For others, they want to learn more. So that's some of my best advice is explore your options, do internships. If you're not limited by geography, go new places, learn new things, explore new cultures, and just be open.
That's great advice. That's a perfect segue of what I was going to ask next is, what are some opportunities for students to network with professionals in this field?
Yeah, I think you can go a couple different directions with this. One is start local. So start looking up folks who have the job that maybe you want, and just go talk to them and see what sort of professional networks they're a part of. Obviously, you can increase that scale and go a little more broad, go on to LinkedIn, start searching, some of those roles, start finding people in your area who do what you want to do. I think that you can look at some of the national governing boards. So whether it's a board that's part of your certification in the future, part of your licensure, it's great to get involved. Oftentimes they have student representatives and roles for students to get involved and to interact with some of their professional peers or potentially future colleagues. And then again, I mentioned some of the continuing education or certifications. And I think those are great to explore. I think they're great for networking. And any sort of networking that you can do is always going to be beneficial. I know at the Career Center, they're very helpful in practicing interviews and practicing getting your resume ready. And especially with how the world is moving, your presence online and how you present yourself with your LinkedIn profile, and just the way that you communicate with other people, it's so expansive compared to 5 or 10 years ago. It's so much greater. It's so much easier to talk to people. There's so many different avenues for doing that. So I would say to utilize that.
That's great advice. Can you give specific key terms? I know students would be curious about what key terms to use, because you'd recommended networking in the local area. So for here, it'd be Kansas City area. Can you give some phrases that they might use in a search?
Yeah, I was doing a little searching earlier today, and it seems like some of the larger institutions and very prestigious institutions like Mayo Clinic and Cleveland Clinic have whole centers, related to functional medicine, and they list all the different roles, which I think is really helpful of folks and services that they offer for patients. But on a little bit more of a local scale, KU Med, looking at local hospitals, but also looking for, one area, if you're interested in more private practice, for example, and maybe how you can help a local community that might have a physician. Direct primary care is also something that's growing today, and that's an area where patients pay maybe a monthly fee or kind of a membership, or they might do a fee for service. So that's interesting to learn to navigate too. I think it's great to, as I mentioned, interview lots of physicians, DOs, nurses, people of all levels of care, and to really talk with them about their experiences. Like I mentioned, I think you can go at the local level and just start talking to physicians, see what their experience has been, or even someone in a role such as massage therapy or, nutrition, and just see where their path has been and where they see it going in the future. I think students today have the opportunity to have such great access to the internet and all of these resources that they can kind of learn about some of these trends and kind of see where healthcare is moving. And what's great for these students is that they're a part of that wave.
Right.
So it's pretty empowering to know that you are part of the direction the tide might be moving.
Yeah. So final question, how would you recommend students get experience in this field? What are some practical steps they could take?
Practical steps.
Yeah.
I recommend for everyone to look for an internship or an opportunity to shadow, and look for, like I said, areas that you're interested in. I would say to go to the Career Center and to utilize all the resources there. I was someone who, was really interested in the Writing Center and needed a lot of support for, cover letters and just a style of writing that might be a kind of a mix between more academic and more personal, to be able to, relay my skills and my expertise to the folks that I might be interested in working with. And I also was someone who really utilized the Career Center and just taking steps each week. So for example, it's really easy to get caught up with classes and deadlines and homework and papers and tests and just things like that. And I think dedicating time each week to some of that personal development and just thinking about what is it that I want to do, and even just a temperature reading of how you're feeling in the current area that you're in, the current area of study. Is there something that sticks out to you in your current, course load? Is there something you want to take? And then I think talking to your professors who might teach in that area too is a great way to gather information, but also a great way to network and see who they know, because a lot of times, on a very basic level, as someone who is a former instructor, students who really reach out to you and try to make a connection and ask questions about maybe your pathway or what you're interested in, or maybe what you studied in undergrad, is so helpful, especially if you need them to write recommendation letters. Being a really active listener in class and participating are just kind of the very most basic things, I think, to kind of get your career started.
It's wonderful advice. Lauren, thank you so much for your time this morning. I appreciate the advice and information that you've relayed about this fascinating field, and thank you so much.
Yeah, absolutely.